viewers, to have you with us on a day with your fertility specialist. It's another Wednesday. I'm excited to be with you guys as your host, Ruth Ogogo. And I know that someone is also excited, just like I am. Today, we'll be talking about questions that have popped up from previous chats that we've had. A lot of questions, and then people have also sent in questions from our last chat last week, Friday. We had a lot of questions coming in because I know I did mention that we'll be dealing with a lot of questions, and then the questions were just so much, so we couldn't wait till Friday. We had to deal with them from today. So we're here to answer your questions. So right now, as the question and answer sessions are going on, keep dropping your questions and we'll definitely attend to them. If not today, there's always another day to attend to your questions. But be sure that we're going to attend to your questions appropriately. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. Right now, as we're starting, share this link with someone, call up someone. If you need to send data to someone, please do that right now so they are able to clear their doubts on any questions they have with regards to fertility. And today, to give us answers to all the questions that have been on your mind, we have Dr. Kenneth Eguda. Yeah, Dr. Ken, it's good to have you with us this
Yeah, I'm
evening.
happy.
So much to say about Dr. Ken. But yeah, even before his whole qualifications and all, I would love to tell you that Dr. Ken is a very amazing and sweet person to deal with. Yeah, so this is coming from your host telling you right now, and then before we talk about before we talk before we now talk about his all the portfolios he has coming behind. Yeah, he's a consultant gynecologist. He's an IVF specialist, also a fertility specialist. He's a minimal access surgeon. He's a reproductive biologist. See the way I'm just saying it like that's because he's just so amazing for someone not to just have all these things. Like, yeah, a lot about him. He's also one of the pioneers of CRISPR in Africa. Yeah. So a lot more. Like I would always say, one of these days, just keep your ears down. We are going to talk about Dr. K, maybe one of the live sessions, and so you know just so much about him. But right now, we're not talking about Dr. Ken. We're here, he's here to give you answers to all the questions that you've had for so long. So keep yourself posted, keep dropping your questions, your thoughts, your opinion, and we'll definitely attend to them. Once again, you're welcome, Dr. Ken. It's good to have you with us today.
Thank you.
Yes, so we have quite a number of questions. Should I say this is like what do they call it in school? Oh, is it OBJ they call it or CBT? Question and answer session. Oh
Yeah.
yeah, so we have a lot of questions from you. A lot of questions have been on the minds of people and they've dropped some of them. So we thought that it's good that we have you address some of those questions. So one of the questions that has come in, this person asks, what's the age limit for ovarian, testicular, and endometrial rejuvenation?
Interesting.
Mm. So yeah.
Sometimes people you think are lay can throw laymen, can throw questions at you that can
Yeah.
actually put you off
Mm,
balance. Um, you know, in as much as there is no clear-cut documentation
mm,
of the age limit for each of these interventions,
yeah.
ovarian rejuvenation, testicular rejuvenation, endometrial rejuvenations,
Yeah.
it's good to be very opt.
Yeah.
Um, Now, for ovarian rejuvenation, for instance, ovarian rejuvenations can be done up to the age of 50, 52.
Mm,
You understand? Uh, the reason I'm having this cutoff is because this is the age that reproductive scientists across the world feel a woman can still get pregnant.
mm,
So pregnancy is not expected or is not advised beyond the age of 50. I
mm.
know we had a woman that we shout about in Africa who did her fertility care under us at the age of 63,
Yeah.
and then she got pregnant and
Mm,
all of that. It went viral and all of that. But then it's good to put safety, around all this procedure. The woman's
yeah.
safety is optimal. Is the priority here,
True.
So 50, 50, 52 for me, it's fine,
Mm,
But then even women who have reached menopause can have ovarian rejuvenation. And
Okay.
now, menopause affects women at different ages in their
Ages.
life. You have women reaching at menopause at the age of 30, for instance,
Wow.
and then they are equivalent in reproductive age to those who get to menopause at the age of 50,
50.
52.
Mm.
So why a woman is doing ovarian rejuvenation at 52 because of menopause? Those who have ovarian failure and pre mature ovarian insufficiency
Yeah.
could have uh, ovarian rejuvenation
Rejuvenation.
at any age,
Mm.
because usually they are less than 40.
Okay.
So
Mm.
there's no cutoff limit. I think the health of the person in perspective is
Yeah.
paramount,
Mm.
knowing that this is done with the intention of getting pregnant.
Yeah.
Except, of course, if you have the meager eggs you want to have and a
Mm.
surrogate
Mm.
is going to take the pregnancy.
Mm.
Yeah, so for endometrial rejuvenation also, that is actually done too for those who intend to carry pregnancy.
Mm.
So I will also want to put a limit of 50-52, because that's the cutoff for health in pregnancy.
Pregnancy. Mm.
So testicular rejuvenation could be done at any age,
Mm.
so long as the guy is still willing to have kids,
Mm.
because reproductive decline for men is less drastic, slower, than that of a woman. And
Mm.
then men have a very prolonged fertility life, even though the quality of the gametes
Mm.
decline as they age or as
Yeah.
we age,
Mm.
and also the tendency of having abnormal babies also increases
Yeah.
as we age. But it can be
Mm.
done to any age in a man, so long as it still intends to have a baby.
Okay. So hope this answers your question. For the person that asked this question, we hope I know he has done justice to that question. So yeah, this person is saying, please, I'm approaching 49 this year. What is the possibility of using my egg to be pregnant and having safe babies free from abnormalities?
Interesting. Just yesterday,
Yeah.
I have somebody in the same condition.
Oh wow.
We've already planned IVF,
Mm.
and then IVF is meant to be with egg donation,
Okay.
and then they visited and they wanted their own eggs. The
Wow.
question I want to ask the women is this. I think I'm throwing these questions back to the women folk.
Yeah.
Why do they get so emotional with their eggs, even when all odds are against them?
Mm.
Because at the end of the day, the trouble still rests with us, because we still have to explain, we have to counsel, and then you may have
Yes.
to bear a bad name that you treated a woman and she
Mm.
didn't succeed. Do
Yeah.
you understand? But then nobody cares to know that it is a kind of decision that this woman takes
Yeah.
that made her fail.
Feel.
You understand? So
Yes.
at the age of 49, for instance,
Mm.
um, it's not a good age to use one's egg, for IVF, except of course ovarian rejuvenation is done. And even with ovarian rejuvenation, let's not make it sound as if it's a golden procedure,
Mm.
as in an ace procedure to be done, and once it's done, it's
Does
a
it you?
eureka, you have to get pregnant.
Mm.
No, you do that and a good number of people still have still have failures. You
Mm.
understand? It just improves the chance a little.
Mm.
But at the age of 49, the chances that the eggs are good, it's practically very, very low.
Mm.
Because at the age of 46, for instance, a woman has 1% chance of getting pregnant with her egg at the age of
Wow.
46. So what
Wow.
are we talking about 49?
Mm.
Though these are research papers, but then you could have outliers,
Yeah.
except of course if we talk about a woman who probably had her ovaries frozen
Mm.
when she was 20, 30s,
Yeah.
and
Yeah.
now take up the ovaries at the age of 45,
Mm.
and then we're going there. Of course, she's 50 and her ovaries would just be about 25 years old. She
Yeah.
could still get pregnant,
Mm.
having healthy babies. But if
Yeah.
it's just a normal woman without any manipulation, the chances are very slim,
Mm.
if at all pregnancy ever happens. And
Yeah.
then the chance of having miscarriages is very, very high, because the age of the eggs and the quality of the eggs that declines as a woman ages affects the chances of getting pregnant, affects miscarriage rate, in which case it takes it higher, and
Mm.
then it makes the woman a candidate for probably having babies with abnormalities.
Yeah.
So it's a kind of pregnancy that you constantly be monitored by the fetal maternal specialists. You know,
Yeah.
anytime you come, you're checking on the babies. And of
Mhm.
course, you could check on the baby all the time and still never discover all the
Some
genetic abnormality that
abnormalities.
could be. It's
Yeah.
only gross abnormalities that
Mm.
the ultrasound machines could pick.
Mm.
Except, of course, you do the non-invasive fetal, I mean, maternal blood testing for
Yeah.
abnormalities. Then you could pick some.
Mm.
It's not a very good age, and that
Wow.
is why we always talk about freezing your eggs if fertility, childbirth, and making of family is not around the corner for you
Corner.
while you are
Mm.
aging. Because if she had frozen the eggs long ago, then of course at 49 there won't be a problem.
Okay.
But then it's not a very good
So she was.
prospect.
I think the same person was asking if your hospital, if ALPS hospitals screen for chromosomal abnormalities.
Yeah, we screen for chromosomal abnormalities. Of course, when we do our advanced IVF,
Okay.
IVF with pre-implantation genetic diagnosis, we
Okay.
screen for chromosomal abnormality, but
Okay.
it's very expensive.
Mm.
It's
It's good you
very
mentioned that.
very expensive.
Yeah.
Yeah, it's a kind of IVF that people will still do when they have AS and AS couples getting married, or
Yeah.
SC and AS couple getting married. You
Married.
know,
Mm.
it's about the same range of costs. Yeah,
Okay.
we do that in
Okay.
case you are interested.
Okay. So someone is also asking, can what can someone do concerning blocked fallopian tubes? And can a successful IVF be done for such a person as well?
Oh, let me start with the second part of the question. The
Mm.
first successful IVF was done 1978
Okay.
because of blocked fallopian tubes. I'm
Oh
talking about
wow.
Lois Brown. Her
Mm.
mother had blocked fallopian tubes. You
Wow.
know, when fallopian tubes are really blocked, there's no way to get pregnant. It's
Mm.
only by IVF because there is no passage for egg and sperms to meet. So
Mm.
it has to be by IVF. That was what
IVF.
her mother had, you know, and then it resulted in the first successful IVF in the world. So
Yeah.
if fallopian tubes are truly blocked,
Mm.
yes, because sometimes there are false blockages. Maybe a mucus plug is blocking something, or spasm during the evaluation makes it looks blocked. You see women getting pregnant. But if it's really blocked, it has to be IVF.
Mm.
Yeah. Then the
Okay.
first part of the question is what
You
again?
said what can someone do concerning blocked tubes? From maybe is there something that can be done when tubes are blocked? Maybe not with regards to IVF. How to unblock or
You know, there are quite a
something.
number of medications out there
Mm.
that people flaunt around,
Okay.
saying it unblocks the fallopian tube. I don't have experience with those medications, and then it hasn't found a way yet into the mainstream gynecological practice,
Mm.
you know. And so I won't be able to make claims to say that there are medications that could unblock the tube, because a lot of things make tubes to be blocked. Disease conditions make tubes to be blocked,
Yeah.
and then they cause adhesions. Maybe
Mm.
complicated pelvic surgeries make tubes to get blocked, and you will have some gynecological conditions like endometriosis, you know, and pelvic inflammatory diseases make tubes to be blocked. If these are actually the cause of the blocked tubes, usually they go with a lot of mechanical problems, you know, and so it's going to be difficult to achieve pregnancy just spontaneously. And if
So,
pregnancy happens, sometimes it could just be in the tubes, you understand, because
mm.
there is no good passage for the eggs, so you end up
Yeah.
having ectopic pregnancy.
Okay.
In as much as we cannot say never, you know, but the odds are very low.
Are there times that some of these diagnostic procedures that they do to discover if tubes are blocked, are there times that it's likely for some people they could get should I say some form of help from it? Maybe if it's like a mucus plug that you said is blocking, are there
Hmm.
times that it can flush out
It's
anything?
very possible. It's
Okay.
very possible.
Okay.
Hmm.
Okay.
Very possible.
Okay. So we have another
But that
question.
means it's not a true blockage.
Oh, okay.
It's not a true blockage.
Mm,
Yeah.
okay. Because I guess she might also be
Mm.
thinking that
Yeah.
line. Mm.
Not a true blockage.
Okay, so many couples are complaining of spending much, but still have failed IVF.
Okay.
Doctor, please throw more light on what to do so that the success rate will be high.
With regards to spending so much, yeah, it's very painful. You have to spend so much to do an IVF, and
Mm,
then if you're living in this part of the world where economy is not very stable, you know,
yeah.
economy it's always fluctuating like a swinging pendulum. And
Mm.
then for Nigeria, it's not like a swinging pendulum. It's always on the
Very
high. It
swift.
just it's just like a plane taking taking off,
Yeah.
and always goes high and stays high and never
Yeah,
comes down.
exactly. Yeah.
So IVF is always going to be expensive. The items used, the medications used, the media are all
Mm.
not manufactured in this region of the world.
World.
They are all
Mm.
imported, and everything is in dollars. And the naira weakens every day against the
Mm.
dollar. You only
Yeah.
expect it to constantly go high. So it's unfortunate. It's a country you find yourself. But you go to some
Mm.
countries like the United Kingdom, for instance, France, Germany, the cost is practically plateau. You
Mm.
understand? It's stable because the economy is stable, the cost of manufacturing, production stable, and
Yeah.
so you could just be able to predict that this is what the cost will be, and the
Yeah.
cost stays that way for a very long time. But not like here, for
That it
instance.
just keeps
Today
changing.
is this way, tomorrow is like this, the next day
Yeah.
is this way,
Oh
and
no.
you just keep
Yes.
just can't
No
predict. No
regulation.
regulation.
Mm.
That's it. So it's beyond what I can answer why it's very expensive. It's the market forces and the value of your local currency.
Mm.
And then, despite how high, how expensive it is, people still fail, unfortunately. And then
Yeah.
a lot more people are going to fail. And
Mm.
the reasons are this. Oftentimes, couple takes a very bad decision. I
Mm.
don't want to use the word stupid.
Mm.
Very bad decision. For instance, a woman at the age of 48 insists using her
Using the
eggs for
egg.
IVF. You
Mm.
could tell how it's going to end. Someone at the age of 49 also insists in using her own eggs for IVF.
Yeah.
And then when they say God told them,
Mm.
and this becomes a matter of God and man now.
Oh yeah.
It's all right. Since God
Mm.
has said so, you
Mm.
know, and at the end you wonder whether it was God who spoke or it
Mm.
was the devil that spoke.
Yeah.
So failures happen. When the sperms are also bad, failures could happen.
Mm.
When a woman has had a lot of procedure on the uterus, call it a D&C,
Mm.
evacuation, complicated fibroid surgery,
Yeah.
complicated cesarean section, or even pelvic inflammatory diseases with
Yeah.
endometritis, you know, all this may affect the lining of the womb and leave
Mm.
scars on the lining of the womb.
Yeah.
You may have the best embryos,
Mm.
grade A plus,
Mm.
and then they don't have a befitting endometrial lining to implant.
Yeah.
You know, IVF may fail. Or if the
Mm.
hormones of the woman at the point of embryo transfer are not healthy,
Mm.
IVF could also fail
Feel.
because the window of implantation may just be narrowed, and then
Mm.
implantation becomes a problem. So, with respect to problems of failure, it's just enormous. Just enormous. As a woman is aging on us by herself, she's having a high chance of failing IVF, even when all things are equal. You know, so it's just a big challenge. Everybody has its own
Peculiar.
peculiar problems,
Yeah.
but then the way to address this is listen to those who knows the human body,
Mm.
who understand reproductive biology, who understand the importance of aging and quality of gametes,
Yeah.
and stick with the instructions that it's given. You understand? So that way you improve on your chance of getting success. So all the investigation that needs to be done. For instance, a good number of people come to visit me,
Yeah.
and then they come with all the investigations. And I say, okay, how about we do hysteroscopy? You've had a myomectomy before, you've had a C-section before, you have a couple of D&C before. And they go saying, my doctor says everything is fine. I say, yeah, your doctor may say so. I'm not your doctor. I'm just one of the doctors you're seeing. And then you stick in your camera into the uterus.
Mm.
Lo and behold, you have a lot of cobwebs, a lot of scars, and sometimes all kinds of things. Polyps, call it chronic endometritis,
Yeah.
fibroid in the uterine cavities. This may be so tiny that ultrasound may not even pick sometimes,
Mm.
and other modalities of investigation may not see. So, if you have a very detailed and in depth investigation
Yeah.
and stick with your doctor's advice and not
Mm.
be unduly sentimental about using your gametes, I
Mm.
think chances of success is going to relatively be high.
Okay. So I hope this question has been answered. Yes, dear viewers, let's take our time to click on the like button, share once again. I want to see your likes. If you know that Dr. Ken is actually answering your questions and you're satisfied, let me see your likes popping up as we continue in our question and answer. So we have a question asking, is it possible to get pregnant after hysteroscopy?
I mean, pregnant by what means now?
Well, maybe spontaneously,
Oh,
I
sure,
guess.
sure. You know, sometimes you could just have some mechanical events going on in the uterine cavity,
Okay.
not diagnosed or identified by some doctors, and
Mm,
preventing pregnancy.
mm.
Then you do hysteroscopy and you take out the mechanical disruptors like
Yes,
polyps, for
yes,
instance.
yes.
And the woman gets pregnant. All of a sudden, we've done quite a number of hysteroscopy planning for IVF, and the
And
woman
then
gets pregnant
pregnant. Wow,
spontaneously.
wow.
So yes, it depends on what the cause of the subfertility is.
Okay,
You could
okay.
get pregnant after hysteroscopy.
Okay, so hope that answers your question. So someone is asking, can fibroids be removed by laser?
Mhm.
That's what the person is
Yes,
asking.
fibroids can be removed by laser.
Okay.
Yes, and I think at this point it's good to mention that we started the laser gynecological surgeries in Africa.
Wow.
Yes, and I pioneered it.
Hmm.
After returning from Barcelona and Bulgaria,
Somebody bring your ears closer
you know,
so you could hear this.
um, from the International School of Laser
Wow.
Gynecologists, I think I
Wow.
was about the first African
That's
to have been
amazing.
there. So on return to Nigeria,
You're supposed to be
haven't
at cloud
been
nine right now.
haven't been empowered by the pioneer of laser surgery,
Wow.
laser gynecological surgery. So we started it.
That's
So
wow.
we do a lot of laser fibroid surgeries, especially
Okay.
by hysteroscopy, and then
Oh,
laser fibroid surgery by laparoscopy.
wow.
And then we can't talk about the benefit enough. It's
Hmm.
enormous benefit using the most refined form of energy in
Yeah.
operating women,
Hmm.
because in addition to the fact that it performs the surgery, it has a regenerative effect
Wow.
on the uterus and on the endometrium as
Hmm.
compared to other sources of energy, which we
Hmm.
still use though when the need arises. Yeah,
Hmm.
but yeah, laser can be used to take out fibroids
Wow.
by any means.
Okay, so
Mm.
I know that question has been properly answered. So someone is also asking, does IVF cause cancer? Mm,
Yes, you see, why we were residents
mm.
so many years, well, maybe not so many years ago now. Yeah, when did I finish residency?
Dr. Ken.
In gynecology? Yeah, about 2015. So during the residency, we have the theories of origin of cancer of the ovaries. Okay,
Okay. Mm.
one of the theories says is incessant um, ovulation theory. That when the
Okay.
woman has frequent ovulation,
Mm.
the little injuries that happen to the ovaries at ovulation can cause cancer. So
Wow.
people transport it to the fact that at IVF, you could have multiple eggs
Mm.
and then multiple oocyte retrieval from various points. And so
Yeah.
there's a lot of trauma going on. So you could have cancer of the ovary. But then, even if incessant ovulation theory is true, meanwhile, I'm going to talk about it in a bit because it's no longer true.
Mm.
You know, ovulation induction in IVF is just done for those who do IVF 3 times using their own eggs, maybe 3 times. But by the way, woman ovulates right from the age of 13 till she is 40.
Mm.
You understand?
Yeah.
So if you have to blame IVF as a cause of cancer, then I think you're not thinking properly, because the same woman has been ovulating all her life
Yeah.
before she started doing IVF.
Mm.
And I don't think I've seen a woman. Well, I've seen a woman who have done about 21 cycles of IVF, all
Wow.
using her eggs. Anyway, that's the highest I've seen.
Wow.
Combination Nigeria,
Hmm.
India, and United Arab Emirates, 21. She got
Wow.
pregnant 3 times.
Oh
You
my
know,
goodness.
then she delivered once.
Wow.
But then that was the highest.
Hmm.
Some have IVF stimulation 4 times,
Hmm.
some 5 times, and all that. So
Wow.
yes, but then a woman ovulates every month.
Hmm.
You have how many 12 months in a
Yeah.
in a year for those who are
Yes.
regular women.
Yeah.
And then if a woman lives for up to 40 years, and start ovulating at the age of 14 or 15, for instance, you can
Yeah.
take away 15 from 40, you tell the number of years she has ovulated.
Yeah.
So yeah, we taught this way when we were residents.
Hmm.
But then from the chambers of research, in reproductive medicine, we now found out that cancer of the ovaries doesn't originate from the ovary itself, but
Hmm.
from the fallopian tubes. So
Wow.
this makes it wrong, the theory of incessant ovulation causing cancer,
Hmm.
and also makes it false that egg retrieval or IVF process causes cancer.
Hmm.
So they don't cause cancer. These are just speculations. And this may come into the regular gynecological books in the next 5 to 7 years, what I
Hmm.
just said. Because these
Wow.
are researches, they have to be validated, and validated before they become the norm of the
Hmm.
gynecologist.
Yeah.
So this is the current knowledge, not from the ovaries, but from the fallopian tubes. That's
Wow.
where they originate from.
Hmm.
So there is no link. It doesn't cause cancer of the ovary. It doesn't.
Hmm.
But then, even if it causes cancer of the ovary, how many times do you do it? How many people use their eggs,
Hmm. Exactly.
for
Hmm.
IVF process?
Yeah.
Then would you say because it causes cancer of the ovary, you don't want to have a child? These
Hmm.
are some local ways of thinking, because anybody who ovulates eventually is at risk of cancer of the ovary if ovulation theory, incessant ovulation theory, is what causes cancer of the ovary. But the current knowledge is that cancer of the ovaries originate from the fallopian tubes, not from the ovary itself. So leave the ovary aside and do the IVF.
But I think people actually have this overall view that once you are ingesting on any hormone related
Mm,
medication,
mm.
it predisposes you to cancer.
Yes, hormone medications like estrogen, for instance,
Hmm.
predispose to cancer of the endometrium.
Hmm.
You
Wow.
understand? But then, how long do you have this hormone ingestion if you're doing an
True.
IVF?
Hmm.
People tend to forget that a woman's body secretes estrogen every month.
Hmm. Yeah.
So if you ask me what rather makes a woman disposed to cancer of the ovary, it's ovulating every month and having estrogen in your system without getting pregnant,
Hmm. Yeah.
because you have
Wow.
constant exposure to estrogen.
Yeah.
Then those that have a polycystic ovary, for instance,
Hmm.
have prolonged exposure to estrogen because they don't menstruate every month, and so
Hmm.
they are at higher risk of ovarian cancer and all
Wow.
of that. So
Hmm.
how much of estrogen do you take when you're doing IVF, for
Hmm.
instance? You take it probably for 6 to 10 weeks,
Hmm.
you know
And
and
then.
these are the same hormones anyway that your body produces when you are pregnant or when you're about to get pregnant.
Hmm.
You understand? So yeah, I think the relation is quite distant. You don't just get the cancer of the endometrium because you're doing IVF or
IVF.
because you are ingesting the medication. Your body
Hmm.
has it all on its own.
Hmm.
You understand? So
And I know you scientists, you always say that they said the cause is unknown. Sometimes they say it could be genetic.
yeah,
So,
exactly. So most cancer conditions are genetic.
mm,
You know, though there are risks, there are things that makes it comes faster.
mm,
When you get exposed to some insult, it makes it come faster. But to a large extent, you have a genetic predisposition. Yeah.
okay, so hope that answers your question. And then this person is asking, are there special meals for IVF patients?
Yeah, oh well,
Yeah.
I don't have enough knowledge here, you know, about meals. But then I know food affects fertility. Pineapple, for instance, we came across a research on pineapple and IVF
Okay.
that it has chemicals in it, that prevents implantation. I've
Wow.
forgotten the name of the chemical right now.
Mm.
So yes, there may be some relationship with
Okay.
this and outcome of IVF, but how strong the relationship is not what I have right now to tell. Yeah,
Mm.
but then food generally affect fertility.
Mm.
The unduly and overtly processed
Food. Okay.
food eaten out of the natural states, processed, carbohydrate processed, and all of that,
Mm.
risk
Okay.
fertility reduction. You understand? Fertility reduction.
Okay.
So food affects,
Okay.
so research and live healthy.
Okay, so I'll take one more question before we ask. So someone they are meddled together. Does moms affect female fertility? And then the person is also asking if a man is azoospermic, can the person also have a successful IVF?
Yes, let's start with the exospermia.
Okay.
There are different reasons why men could become exospermia. You could be exospermic and then you have obstructive exospermia.
Okay.
That's to say, your body still produces the sperms,
Okay.
but the conduit through which the sperm is ejaculated is
Mm.
blocked.
Okay.
In this case, you could have a surgical procedure when your wife is undergoing an IVF process, and
Okay.
then a surgical extraction of sperms could be done, and then you
Okay.
could have good enough sperms to achieve pregnancy.
Wow.
You understand? So
Okay.
yes, so this is a obstructive exospermia.
Okay.
But if you have non-obstructive exospermia, it means there's a problem with production of sperms.
Mm.
So you probably don't have sperms. For some reasons, could be genetic, often genetic. And then or even exposure to some chemicals or hostile environment.
Mm.
In that case, you need to have a sperm donation.
Okay.
Yeah, but it's good to mention at this point that even when sperms are gotten by surgical extraction, because they are not ejaculated frequently, there's high risks of the reduced chance of getting pregnant with them
Mm.
because they are already exposed to oxidative stress within
Wow.
their domicile, and they may also be extracted
Okay.
at various level of maturation.
Mm.
So you could have sperms that are not very matured.
Okay.
And then if they are not very mature, chance of getting pregnant is also low with them. Except you culture them and grow them again in the
Okay.
laboratory,
Mm.
and then you use them to get the woman pregnant. Then the other one is moms.
Yes, if moms
Yes,
affect.
moms affects women.
Oh wow.
Yes, it causes swelling of the ovaries.
Okay.
Just the way it affects the testicles of guys
Yeah.
when they have mumps or chitis,
Yeah.
you know, and it affects women, and so
Okay.
it reduces their fertility potentials at the same
Wow.
time. It's
Wow.
it's it's known to disrupt ovarian function.
Wow.
Yeah,
Wow.
it
Okay.
does affect women.
That's a lot. So
Mhm,
much to get from this
mhm,
today.
yeah.
So, this person saying, Doctor, aside from menopause, what may be the reason for not menstruating for 1 year? Hmm.
Quite a number of reasons apart from menopause, which is a natural biology, where women stop menstruating.
Yeah.
Other reasons could be some disease conditions like polycystic ovary. That's one
Okay.
of the commonest cause.
Wow.
Yeah. Sometimes they don't menstruate for 3 months,
Hmm.
6 months, occasionally 1 year.
Wow.
So those are some reasons why women will not menstruate.
Okay.
Yes,
Okay.
and of course,
Okay.
when they are
Wow.
still
Hmm.
kids,
Okay.
you know. Then the other reasons could just be any other procedure that affects the function of the ovaries, in which
Hmm.
case it's also causing induced menopause,
Yeah.
artificial menopause,
Hmm.
So call it radiation, chemotherapy, accidents, accidental removal of the ovaries during
Hmm.
procedures,
Hmm.
and all of that.
Okay, so hope this answers your question. But
Mm.
however, if you're young and you feel they've assessed you properly, maybe you could still check
Mm.
to see another specialist.
Ovarian failure happens a lot in young girls,
Mm,
and then it's good for them to be checked.
mm.
There are genetic conditions like Mayor Rokitansky syndrome, for
Oh, wow.
instance, is a condition that women are born without the uterus,
Wow.
and so if you don't
Mm.
have a uterus, you can't menstruate. They also have
Yeah.
tiny ovaries
Wow.
that may not be functional.
Mm.
They can also not menstruate. So you have other genetic conditions, the Turner syndrome, for instance.
Mm.
Yeah, they may also not menstruate because they have small ovaries. You need to have
Wow.
ovaries and uterus to menstruate. If you
Mm.
have a genetic condition where you have no ovaries, you will not menstruate.
Wow.
If you have ovaries without uterus, you also wouldn't menstruate.
Wow. So a lot of knowledge is being dispensed right here today.
And then let's talk about Africa a bit or Nigeria. When women have this D&C,
Yeah.
dilatation and curettage. By the way, dilatation and curettage has been rendered obsolete.
Okay. Mm.
Yes. As in 2 years ago in Malaga, there was a big conference on the uterus
Mm.
that 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 makes intend to make D&C obsolete,
Okay.
and it should be stopped.
Mm.
And it's now even considered as a criminal procedure,
Wow.
even when done in the right circumstances.
Okay.
So it is said that it should be abolished.
Okay.
The reason is that DNC was was commenced several years,
Hmm.
right in the 80s. I mean 18th. I mean we're in 19th. Is it 19th centuries? We're in 19th century
Yeah, I
right
think
now.
20,
20th
20th.
century.
Yeah.
Okay, 19th or 18th century,
Oh, wow.
and it has not modified.
Hmm.
You understand? And then D&C scrapes the entire uterine wall,
Oh my.
scrapes both the baby,
Hmm.
the attachment of the baby, and the
Yeah.
other functional parts where the
Part
baby is not
is not.
attached to.
Oh wow.
And depending on how extensive or how aggressive this is done,
Hmm.
it could touch the junctional layer of the line of the uterus,
Hmm.
and then leaves you with a lot of adhesions. So
Hmm.
some women have D&C done, quote and unquote, very aggressively,
Wow.
and they never menstruate after that.
Oh
So
my
that
goodness.
condition can make a woman not to
To
menstruate.
menstruate.
And then
Wow.
also her ovaries are functional, she's ovulating, but she
Hmm.
can't also be pregnant because the lining of the womb
Has been
has been
tempered with.
tampered with, has
Yeah.
been damaged. You
Hmm.
know, it's difficult to grow it.
Hmm.
It's the most important part of a woman's reproduction. If
Wow.
I was a woman, if I'm a woman, I would, I don't mind anything affecting any other part of the female reproductive system, but not the lining of the womb.
Wow.
Yes. And so, what is advised with the D&C now is you do the D&C under hysteroscopy.
Hmm.
Because if you're doing it under hysteroscopy, for instance, you see where the attachment of the
Hmm.
baby is to the wall of the uterus.
Oh
So you
wow.
just scrape
That part.
just that part,
Hmm.
which may just be like, well, depending on the size of the pregnancy, usually
Yeah.
early pregnancy, 6 to 8 weeks, you can do hysteroscopy to take them out.
Hmm.
You see just the attachment, you just take out
That
with the
part.
just
Wow.
shave it off gently,
Hmm.
and then you bring it out and leave the other part of the uterus healthy. But
Healthy.
because D&C is done blind,
Hmm.
we did all these things in our early days in gynecology. I remember the doctor would say, "Hey, keep scraping until
Oh
you
my
feel a gritty,
goodness.
grinding sensation."
Oh my.
I was like, when I look
Ooh.
back and I remember and I think of all those things that
Hmm.
we've been taught, I
Yeah.
think I'm glad that I've unlearned it and I'm
Hmm.
beginning to do the right thing. So
Yeah.
D&C is very bad. And that is why if you come to us for an IVF and you have had history of D&C, we insist you should have a hysteroscopy. We need to understand what's happening in the lining of your uterus,
Yeah.
so we are sure where we're dropping the
The baby.
embryos, and so also have explanation for success or failures, because
Hmm.
IVF must go either ways, and in
Yeah.
either case
True.
we need to have an explanation. So D&C is bad.
Hmm. Okay, so we have a lot of questions also coming up. If you, if someone, the person is asking, if you use a donor egg to get pregnant, what would the baby have? Or no, will the baby have your genes or the genes of the donor?
Interesting.
Mm.
So now, in a nutshell, the
Apologies for the breaking transmission. Yeah, so we have a question. The person is saying, Doctor, if I get pregnant with donor eggs, does the baby have my gene or the gene of the donor? Hmm.
Yeah, interesting question. This part of science was first shown to me by a patient herself.
Oh, wow.
Yes, sometimes some patients are super intelligent.
Hmm.
They're uncomfortable with a situation, so they go researching. I was consulting her, and she was going to have a IVF with egg donation, and she gave me all these research papers.
Wow.
You know, telling me that if you get pregnant with a donor egg, there is a transfer of genetic material from you, the mother, the carrier, to the
Hmm.
baby.
Hmm.
And then I pick up these papers and I went researching and I came up with the same findings that she had in her own papers.
Hmm.
So yeah, it makes it a lot easier to accept donor eggs because it doesn't mean everything about the baby is from the donor.
Hmm.
There is a lot of transfer of genetic materials by osmosis and other means from the carrier, in this case the mother now,
Yeah.
to the baby. So the donor egg doesn't technically necessarily mean the strange person eggs. I think nature makes it such a way that you take it, your body accepts it and makes it yours.
Yes.
So you
Hmm.
find a lot of your genetic materials, and maybe that's the reason why you have some couples do IVF with donor egg and the baby is looking like like the woman,
Hmm.
because
Wow.
there's a transfer. So genes are so interesting, the way they manifest and the way they behave, as
Hmm.
if what makes them get transferred and the modalities or means by which they are transferred is still a mystery. And that takes me to like the Bible,
Hmm.
when Jacob was making some animals to look at some other animals,
Hmm.
and then they were turning out to be like those animals,
Yeah. Hmm.
even without having any physical contact, according to the
Yeah.
Bible history. I don't know how that
Yes.
happens. So when you stay even close to somebody, you begin to look like the
Like the
person.
person.
So
Hmm.
epigenetic
Oh yeah. I
stories.
mean, when Moses, they said when Moses stayed with God, his face began. They say it was he exuding glory or his face was shining.
Something like that.
Okay.
Yeah.
So for another question coming up, for someone with PCOS who doesn't have money for IVF, what can she do to achieve pregnancy?
Yeah, she needs to see her gynecologist,
Mm.
evaluate her. PCOS are in degrees. There are
Mm.
4 phenotypes of PCOS.
Okay.
Phenotype A, phenotype B, C, and D. C
Mm.
and D are bad categories of PCO, and
Mm.
those are usually very difficult to manage. A, B, fair enough. They can get pregnant spontaneously, you know, and then for some, you need some of hormonal manipulation. Remember that
Okay.
PCO doesn't have a cure, but it
Mm.
can be managed. It can be
Okay.
manipulated.
Wow.
Be given medications to kind of change the hormone milieu in the body to create
Mm.
healthy conditions for ovaries to develop and ovulate. Then a woman can get pregnant. But then she can do ovarian drilling.
Okay.
That's kind of the most advanced treatment for polycystic ovarian drilling. And for
Mm.
us in ARPS, for instance, when we see women with PCO and are going in for IVF, the challenge usually is the quality of eggs that they produce. Maybe
Yeah.
one day we'll talk about PCO in a large scale,
Mm.
and then usually they produce plenty eggs and the quality may just not be too great.
Mm.
So we do everything to improve on the chances of producing good eggs,
Okay.
including giving them medications, the supplement that PCO guys takes, and laparoscopic ovarian drilling to
Okay.
kind of bond the stroma and
Okay.
improve on the androgen condition of the
Mm.
ovaries so
Yeah.
that better eggs are produced or retrieved during their procedures. So
Mm.
you could have ovarian drilling and get pregnant spontaneously
Wow.
without
Okay.
having to do an IVF if other conditions that make for spontaneous,
Pregnancy.
unaided pregnancy
Mm.
possible are there in you.
Okay.
But then you could have PCO and still have to do IVF if your partner, the male partner, has no sperms or has very low sperm count.
Mm.
Yeah. So it's not all the time that it's the woman that has the problem.
Yeah. Sure.
I've seen PCO cases where these women never menstruate, but they
Wow.
get pregnant.
Oh
And some of them
wow.
have 4 kids.
Okay.
No
Wow.
menstruation, but
Mm.
they got pregnant. I have
Wow.
seen them.
Wow. Wow.
Then I've seen families of ladies all have PCO.
PCO. Wow.
From
Wow.
the grandmother,
Hmm.
the mother, and kids. All PCO. I've seen all
Wow.
of that.
Wow. Okay. So hope that answers your question. If all conditions are right, yes, it mustn't be IVF if you get the right intervention from good fertility specialists like Dr. Ken and Alp's team. Okay, so we have another question coming. Are there medical remedies for thin endometrium?
Hmm.
Mm,
Oh well, you have first of all to understand what the cause of the thin endometrium is.
okay,
You know, endometrium is said to be thin when it's less than 7 millimeters,
okay,
and usually when it's that less than 7 millimeters, the chance of getting pregnant is slim.
okay.
It's possible but slim. Now,
Mm,
what are the remedies? Understand the cause of the endometrial thinness.
thinness. Mm,
If it's adhesions, you have to go hysteroscopy, deal with adhesions. Sometimes you have to burn the entire adhesions and try to grow the lining of the womb afresh.
okay.
The mysteries I see in endometrial care,
Mm,
because I was privileged to work with specialists, experts in endometrial health.
wow.
And one of them is my boss in Bulgaria.
Mm,
You know, sometimes it takes out all the endometrium
wow.
and grows the endometrium afresh.
Mm,
It takes 6 months, 8 months, monitors it patiently and
mm,
watch the endometrial growth. Just amazing how this guy works.
wow.
So sometimes depending on the problems you're having in the endometrium, you could burn it all out and grow it all over again.
Mm,
Yes. Then you could grow it when it is too thin using the stem cells, the
okay.
precursor stem cells, the
Mm,
PRPs. You
mm,
could do all of that to grow the
okay.
endometrium.
Okay.
What I can't talk about right now is endometrial transplants.
Mm,
Science hasn't gotten there, but
yeah.
maybe the fact that I'm mentioning it now
Maybe to see the
means
limelight.
it's going to happen very soon.
Yeah.
So those are some things to do with endometrium. And then if it is normal for a woman to have a thin endometrium, as in genetically predisposed to having thin endometrium, then she could still get pregnant with a
Okay.
thin endometrium.
Oh
Because I
wow.
have seen women with thin endometrium, no procedure has been done on the uterus before, and they
Hmm.
got pregnant
Wow.
spontaneously.
Wow.
In fact, it's so bad that their menstruation could just be a day and it would just be
Hmm.
a drop.
Wow.
Yes, I've seen them. Very big
Oh.
grown girls,
Hmm.
good phenotypic female development, and
Wow.
they got pregnant. So yeah,
Okay.
endometrium is a big aspect of her science in reproduction that we are very biased about, those of
Hmm.
us in reproductive medicine. And then if I have guys doing surgeries in the facility, for instance, for me,
Yeah.
even if I'm not the one operating, I stand over them and make sure the endometrium is not touched because it easily run into problems.
Okay, so we've dear viewers, keep your questions coming up. We'll be taking the last question now as we wrap up. Yeah. I know that we can never be I know your questions are inexhaustible, but we'll keep attending to them. But this will be the last one we'll take for the show today. She said, Doc, what's the success rate for AS couple who wants twin or triplets?
Huh? That's a tough one.
Yeah.
If they're doing a pre-implantation genetic diagnosis, success rate is very high.
Hmm.
Now it depends on other factors. The
Yeah.
age of the woman, during which time this procedures is being done, the quality of the gametes that are used. If the age is good age, and I'm talking about age less than 35, and the sperms are good sperms from a very young man,
Hmm.
and then the lining of the uterus is fine, no scars, and
The money is there.
the money is there, the success rate is very high. And
Hmm.
then you could get twins, but going beyond twins could be very bad, because triplets pregnancy is not very great. A lot of problems goes with it, but
Hmm.
yeah, the success rate is high if all things are okay.
Okay, so hope that answers your question. If you need more clarification on this, you could chat us up privately and
But it's
we
very
definitely
expensive.
yeah, that's why we say money. Yeah. So you could keep dropping your questions like we displayed on Friday. There's a number on the screen that you could always chat up to ask your questions. We definitely attend to them appropriately. It's been amazing having your dear viewers stay with us today. Like we really had an amazing time. Dr. Ken, did you have a good time with our viewers? Hope they did. They-
I'm not used to talking so much like this. I talk so much, I think my
oh yeah,
jaws are aching already.
they wore you off with questions a lot. Yeah, but yeah, we're enjoying your questions and we're glad that we're able to satisfy you as much as we can. For those of you that don't feel so satisfied with the answers given, like I said, either you book for an online consultation, you could as well also chat us up, or you could also see us physically in person at Alps.
They may just have to book a private jet for me. I can practice medicine anywhere.
Okay. Yeah, so it's been amazing having you, Dr. Ken, today. Thank you
Thank
so
you.
much for being with us today. Thank you, dear viewers. Until we come your way next time, have a good evening.